Welcome, everyone. My name is Elian Ramos, and tonight I am so happy that we are all here because we are celebrating National Minority Health Month. It's actually the end of the National Minority Health Month. So this whole month of April, there's been a lot of activity going on all over the country, raising awareness about health disparities, especially in the minority and disadvantaged communities. As you know, these disparities affect minority communities and disadvantaged communities, such as the Latino community, in a disproportionate way. And so tonight I have a group of experts here who are going to be talking about some of the statistics that have to do with health disparities in the Latino community and beyond. And also they're going to be talking about some of the proposed initiatives and activities to help make those disparities better. And we're also going to be talking about some of the resources that these disadvantaged communities can take advantage of. So first off, I have, going from my left, Donna Barry, who is the Director of Women's Health and Rights at the Center for American Progress. How are you, Donna?
I'm fine. Thanks so much for having me on tonight.
Thank you for being here. Next to Donna, we have Jose Plaza, who is the National Director of Latino Engagement for Enroll America. And he's also been here before. So, Jose, welcome back.
Thank you for having me back, and hello, everyone.
Next up, we have Sinsi Hernández-Cancio, who is the Director of Health Equity for Families USA. How are you, Sinsi?
I'm well. Thank you for inviting me to my first Google Hangout.
Oh, so exciting. You're going to love it. Just see. And last but not least, certainly, we have Tony Welch, who is the press secretary for the Office of Minority Health. How are you, Tony? Thanks for being here.
I'm doing great, and like Sinsi, it's my first Google Hangout too, so glad to be here.
Oh, wow. A lot of newbies here. I'm so happy you're all here. So let's start with, I'm going to give you the easy question first. Let's define what National Minority Health Month is for people who don't know what it is. And also, like, why do we need a health month just for minorities? Who wants to go first?
This is Tony Welch. As coming from the Office of Minority Health, one of the things to note is that 100 years ago, it was Booker T. Washington that actually began with Minority Health Week, and that had to do, and that was created because there were so many disparities that he wanted to address, of course, by dealing with Negro Health Week. And what he noted was, I think that there were 450,000 excess deaths among African Americans or blacks, and in order to call attention to it, the whole point was, well, how do we call attention to those disparities? And he began with Negro Health Week is what he called it, which became National Minority Health Month, as we call it now. And I'll let others speak here. I don't want to take up all the time, but I do like the beginning of that says, if you're going to address disparities like that, then it begins with a week and an opportunity to call attention to it. And that still holds true today. There's much more we can say about it, I'm sure, but that purpose still holds true.
Wow, a history lesson here. Anyone else wants to add anything?
Well, this is Donna. That's just one of the things that I wanted to highlight was that it's important that we have at least a month to point out that we still have these terrible disparities among health outcomes in the minority communities, and it's an opportunity for us to, as you opened up the program, to talk about them and highlight them, but then also talk about some of the solutions we have to solve them.
Beautiful. Beautiful. Let's continue on that same vein. As you all mentioned, minorities are impacted disproportionately with these health disparities. But what are some of the disparities? It's important that we define what they are, because it's not just something very abstract. It's something that impacts people every day.
That's true, and one of the things that is important to remember is that there are each group, whether you're African American or Latino or Asian Pacific Islander or American Indian, will have different disparities that affect them. Some of them are, in common, and some of them aren't. But I know that your audience is mostly Latino, so for example, one of the big disparities that is affecting a lot of Latinos is how much more likely it is that we'll have diabetes. And diabetes, we have a 65% more chance of having diabetes. And thank you for showing one of our disparities from one of our infographics from Families USA that show some of them. But the thing is that not only are we more likely to have diabetes, but then we're also more likely to die from diabetes and also to have much, very bad complications, like, for example, having to get a leg amputated. And the really sad thing about this is that if it's, first of all, diabetes is something that's preventable. And sadly, we're seeing that people are getting diabetes younger and younger. And there's a lot that can be done about it in communities as far as, making it easier for people to have better diets, better opportunities for exercise, and so forth. But the other thing is that having health care to address it once you have it is really, really critically important, because if you control it well, there is no reason why you have to lose a leg or lose your eyesight or lose a kidney because of diabetes. And sadly, we're seeing that happen a lot more often in our communities.
And as we saw on the screen, it's not just the Latino community that is suffering from these disparities. It's also the American Indian community, the Alaskan Natives, the African American, the Asian American. So it's really something that affects everyone, and this is why I'm so impressed and so excited that all of this is being done. So let's put it. Go ahead, Sinsi.
I was going to say, and the thing about that is, it's one thing to see it all in a pretty colored infographic like what you just showed, but I think all of us in our communities know what it's like to have somebody who's very, very chronically ill, what it's like to lose a family member because of these disparities. It's not just numbers, it's actually lives and entire communities that are being undermined because of these health disparities.
Very true, very true. And let's put it into even a bigger perspective. And I'm gonna go back to Tony, because Tony, you're the history guy.
I start that way, right?
Yes. Let's put it into perspective. 30 years ago, the Secretary's Task Force on Black and Minority Health. This is what it was called back then.
That's right.
They published something called the Heckler Report. And this report has been updated recently. So can you explain to us what the report was, what it is, now that it has been updated? What are some of the findings, and also what are some of the differences between what was found so many years ago and what you found in the most recent report?
Well, and thanks a lot. For this Minority Health Month, the focus has been on the Heckler Report, as you said, 30 years ago. And it's named the Heckler Report because the Secretary of HHS at the time was Margaret Heckler. And we had a summit yesterday at the Capitol, and Margaret Heckler was there and addressed the group and explained something very important. She explained, so here's why I wanted to do the report. And conditions were such, disparities were such, that she put together a task force, asked for the report. That task force, here's what was interesting. It wasn't just that she received the report. It was the willingness to do two other things: to actually publish the report and to act upon it. In fact, our office, the Office of Minority Health, was created a year later. So among the task force's findings, that 6 conditions were accounted for 80% of the deaths among African Americans at the time. Here's an interesting point. At the time, and I think 4 years later, we did not collect mortality data on Latinos in the country. So it simply wasn't available, wasn't knowable, wasn't studyable. But the conditions were cancer, cardiovascular disease and stroke, diabetes, homicide and violence, infant mortality, and chemical dependency. So those were the 6 conditions where they focused much of their attention. Of course, then we'd gone from 450,000 deaths 100 years ago. Then it was 60,000 excess deaths a year, and that's where the focus was, with many recommendations for addressing them, awareness being one of them, not surprisingly. I don't want to eat up everyone else's time, but it was it was an important day at the summit yesterday with Dr. Heckler and other leaders in health equity coming together to not just celebrate some progress that's been made. For instance, infant mortality is down, death rates are lower for African Americans and minorities across the board, with still a lot of room to go. And so a major part of the focus was on where do we go from here? Where do we go from here? With a good focus on that. So
beautiful. And I think the most important part of talking about this in studying, and putting together this report also has to do with, realizing what some of the causes are. Obviously this is not a standalone issue. And I want to talk a little bit to Donna, because at the Center for American Progress, you usually deal with things that have to do with policy, right? And so when we look at this disparity,
So can everyone else still hear?
Oh, there she is.
Oh, she's back? Okay, great.
and we're back. Sorry. So, sorry about that. We had some technical difficulties there, apparently. And I think we lost Donna. But are you here?
You're not here?
Okay.
I am.
See you now.
Okay.
Okay. Sorry, this is live, so anything can happen, as you know. So what I was saying, Donna, is that some of these things are not standalone, but there are some factors that actually, social determinants, for example, that influence all of this. How can these influences be addressed through policy, and being that this is your expertise?
Sure. So, I think there's obviously a lot of health policy that I think we'll probably get to towards the end of the discussion that have huge impacts for folks. But there's things that have policy implications on health that we don't normally think of. And so a couple things that I wanted to highlight that CAP works on, starting, I guess, from infancy and when kids are small, we're working on early childhood programs, whether it's home visitation programs, equal access to quality daycare, early childhood education, and having much better access, particularly for people of color and their families. And that leads into some of the work that then we're doing on public education and both the quality and financing and curricula and standards in those places. Those have huge implications for health outcomes later in life, but that then leads into higher education and both access to higher education as well as student loan financing, and then debt repayment after we get out of school, and how much we can then spend on healthcare and spend on our lives. And then we get to things like workplace issues, which have huge, I think, family impacts for health outcomes. And a few of the issues that we're working on at CAP include, increasing minimum wage, reducing the wage gap, looking at paid sick leave and paid family medical leave, so that women both can get health care themselves, but also can take time off to take care of family members and take kids to doctor's appointments, whether it's preventive care or curative things. 40% of married Latino women and over 50% of married African American women bring in over half their family's income. So the fact that they can both be able to earn good incomes, but also then take time off to take care of families is really, really critical today. A couple other things I wanted to throw in, and also not to take up all our time, but housing, both neighborhood issues I think are really huge. So housing and how that impacts asthma rates and a lot of childhood illness issues, exposure to violence, we know can genetically age kids. We've got big issues with food deserts for all the populations that we've been talking about, and also walkable cities and being able to just get exercise and during the day rather than have we know we've cut it out of public schools these days, and so it's something that kids are just not getting the exercise they need. And just to get on my soapbox of healthcare, of how healthcare policy impacts, health outcomes. Obviously we're at CAP. We're also working on improving the ACA as well as making sure that everyone has access to it, whether it's through private insurance or expanding Medicaid, and particularly in those states that haven't expanded Medicaid. They've got some of the worst health outcomes for women and children in particular that we see in the country. And, we also want to make sure that the health care that people have covers all of their health needs. So particularly reproductive health care, whether it's all types of family planning, it's abortion care, it's prenatal care, maternity care when women need it. Unfortunately, we're now seeing a reduction in access to all types of health care through a lot of restrictive laws being passed at the state's side. So, I'll just finish that, this got highlighted last week in a bunch of news articles that, the United States is one of the only countries in which the maternal mortality rate is actually increasing, and we've seen a huge jump in it over the last decade, from 7.2 deaths per 100,000 births to 18.5, which is huge. It's almost a tripling. And you take a state like Mississippi, where the total maternal mortality rate is 40 per 100,000 births, but for blacks it's 54.7, and for whites it's 29.3. So we've got huge disparities, and we've still got so many policy ways that we can solve these, but it stretches from all the social policies to health, improving the healthcare policies.
Wow, and I mean, those statistics are startling. It's almost like unbelievable, and to think that the things that could help to bridge some of those disparities are being under attack.
Right.
So in speaking of that, I would say I want to jump to you now, because I want you to talk about what is the role that the Affordable Care Act has in fixing some of these disparities. Let's put this into context, because I think it's more than just insurance.
Of course, and I think to what everyone has been mentioning, these issues are historic, they're pervasive in our communities, and the one important thing about how historic the ACA is that it finally provides a gap for families that before couldn't afford health coverage, that couldn't have access to quality health care as well as culturally competent care. Now they actually finally have access to that, and to fix and start curing or getting on a plan that could start helping them with these ailments that are curable, like diabetes and blood pressure and issues with mental health and simple things like nutrition. So the ACA does that for men and women and children. We've seen in the Latino community, young Latinos have actually seen one of the greatest drops when it comes to health insurance coverage. Needless to say, with Medicaid and Medicare as well as with CHIP, Latinos are one of the most highest groups to benefit from these programs. And so it is important that we recognize the role ACA plays for the nation as a whole, but also it begins to provide equity and equality for Latinos and African Americans and other people of color that historically wasn't there before. As we've mentioned, there's folks that can get coverage for less than $100 a month, and there's in a lot of states, folks are getting insurance coverage completely for free. And so it isn't really about insurance or being scared of the fee, but really is developing this culture of healthcare and being aware of our health, and then also teaching them how to use this new resource that a lot of folks haven't had in terms of health insurance.
Mm-hmm. Anybody else want to add anything to that?
I want to echo what Jose said. It is remarkable to see the gains and to note that the largest gains are among Latinos, but that among African Americans as well, there were incredibly large gains of people who had been previously uninsured, who gained insurance over the last 5 years. And Jose phrased it as a beginning of health equity, and it's right. There's this arc where there has been improvement for sure, and the ACA stands out as a huge success in that regard.
And in terms of data, earlier it was mentioned how information on Latinos had just been started to be collected not that long ago. And even though there's a lot of gaps with the information that we are collecting now on ACA and those recipients, we are starting to see zip code level data those that are actually getting information. And a lot of improvement needs to be done in those areas, but it's a small step. I say Rome wasn't built in a day, and so I'm very hopeful that as we begin rolling out ACA and as we see it become common practice in our communities, we're going to learn a lot more about our communities and the health issues that we continue to face, but also ways to ameliorate those issues.
And speaking of that, speaking of the ways to fix these issues, what are organizations like yours doing to tackle all of these barriers at the community level? And not just now during Minority Health Month, but beyond that, like throughout the year.
So at Families USA, clearly, we have been working on with a lot of organizations like Jose's and trying to make it easier and more likely for people of color to be able to enroll, because getting an insurance card is a very, very essential first step in addressing all these healthcare barriers. But one of the things that we also know is that having an insurance card is a lot like having a cell phone. It's only as good as the network it's on. And we know that in a lot of communities, the networks, literally like what doctors you can go to in your insurance network, but also more broadly thinking about it, like what are the resources that you can actually access in terms of not only who's there, who can see you, who can you go to that understands your language, who can you go to that you feel comfortable talking in your culture, understands your cultural background, and also like how good is the quality of the care that you're getting. These are all like the next generation, the next step of challenges that we believe that we have to really dig into and get more involved in, especially as there's a lot of attention right now in trying to change the way healthcare is paid for in ways that incentivize good care and not lots of care, because lots of care isn't always the best thing. You want to make sure you have good care. And we need to make sure that as this is done, it's done to the benefit of those that are most vulnerable and need the most improvement in access to care, and that doesn't inadvertently hurt those safety net providers that have been struggling for sometimes generations to keep providing basic care and maybe won't be able to like keep up with these changes. So it's really important to think about the next step. We need to keep getting people covered. We need to make sure we fight to get Medicaid reform, Medicaid expansion passed everywhere. And then we got to think about, well, what does it get you? Let's make sure that it's valuable, accessible, understandable, and of high quality.
Very true, very true. And Donna, do you wanna add to that? What is your organization doing?
Sure. So, at the Center for American Progress, we're, working also at a little bit of the higher policy level to look at affordability of plans and affordability of care and make sure that costs aren't rising too much. Looking at, expanding providers who can provide care, whether it, nurse practitioners, physicians assistants, etc. Also, the one side of the organization is working also very hard on Medicaid expansion. And then we've really been trying to promote the preventive care that's available without additional cost for folks, because some of the worst outcomes we see, even when people do access care, is like treatment outcomes from breast cancer are far worse for women of color, and so really trying to make sure that people are getting in early enough so that cancers and things like that are getting detected early, but also working with some other organizations to hold insurance companies and others to feet to the fire to make sure that they're covering everything that they're supposed to be covering for women without cost. So, all forms of family planning and all of these preventive services that the ACA says are covered without any additional fees. And we're finding that a lot, in fact, when people are accessing services, they're still having to pay.
Right, very important, very important. And Jose?
So I've said it before. I think the ACA, really, a lot of people think of it as health insurance and reforming the medical system that we have in place, but really on the ground, this is a campaign and a law about education. It's about education, about the benefits, about our rights as citizens in terms of the health care that we should be afforded, have it be quality, accessible, have it be where it's delivered in a culturally competent as well as linguistically sensitive way. As Sinsi mentioned, it's a lot about education and making sure that folks understand not only what it takes to get health coverage, but then how to keep it and how to use it. A lot of folks we've been noticing in communities of color have health insurance, but they have no clue how to use it, and the only time that they're concerned about learning how to use it is when they're in the hospital, in the ER room. And so we have to make sure that this becomes part of, the cultural component of health coverage. And just as we do our taxes every year, and half of us don't understand how we do taxes, but we're able to jump on H&R Block and type in a couple numbers, and there you go. You either owe or you're getting money. We need to make the system of healthcare that simple, where it's not something that we use it only when we need it, but that we understand the basics of it so that it becomes part of our everyday culture.
I want to add on to
what I'm so sorry. This is some of what Enroll is doing as well, Jose, right?
Yeah, so Enroll America, we're in 11 states. We have staff across the country that is working on the ground to provide those education campaigns, and we mobilize other partners that work in the Latino community, not only Latino organizations, but other organizations that are engaged in the community. And so everything from faith, from women to youth, we make sure to provide those avenues and training as well for other partners to be able to do this work once Enroll is no longer here.
Great. And Tony, I'm so sorry I interrupted you.
No, it's fine. I wanted to add on to Jose because there is, for coverage to care, which is run by CMS, you can get to it through minorityhealth.gov too, but it has a roadmap to care to help people who are more unfamiliar with how to use their new coverage learn how to use it, and it raises a very good point. At the Office of Minority Health, one of our major charges is with implementation of the HHS Disparities Action Plan, and that's to ensure that we think of health equity first and foremost across all our programs and policies, and that helps us with everything from Promotores de Salud to the National Health Service Corps, and which the Affordable Care Act gave a big boost with $1.5 billion. That's important work happening in our country, and we're proud to be a part of it.
Beautiful. And in that same vein, you just mentioned the action plan for the Department of Health and Human Services. So what are some of the goals of that plan?
Well, the goals are to transform healthcare, and that gets to the Health Service Corps. In fact, in 2008, there were approximately 3,600 participants, and in 2013, we were up to 9,000 clinicians providing services to more than 9.3 million people. So that's the goal, and meeting it. Another is strengthening the nation's health and human services infrastructure and workforce, and that gets to the work we do with Promotores de Salud, which are helping communities across the country. In fact, we will have a new e-learning program coming out soon in that regard that we're looking forward to, and with the Office of Minority Health and the work we do at the local level, some of the Promotores de Salud, although not all, were part of our initiative to help explain the benefits of the Affordable Care Act to people who need coverage. And I keep going on and on, but I think we're going to run out of time soon. We're at 7:29. What time do we leave? 7:30?
Yeah, it's supposed to be at 7:30,
okay.
And we're right on the ending line here. But I want to give you the chance to have a call to action. What is the most important thing that people can do out there to protect themselves against disparities, and also to support the work that you are doing?
Well, I would say the most important thing is to make sure, we're in this culture change now of making it we want to make it natural that everybody has insurance as much as possible. There's some people that are still going to have a lot of challenges, but it's really important that from word of mouth, from your comadre, from your family members, you're checking in and saying, make sure you have your insurance, and make sure you go get your preventive care, get your annual checkup, because you can be hearing stuff on TV or on the radio or whatever, but really, who do you listen to? Well, your mom, when she calls you up and says, mijo, go get your checkup. So it's important that we all, in a certain sense, like the president says, we are brothers keepers. We should be really making an effort to talk in our communities about the importance of getting the coverage, that there's help available, and that use it. Use it before things really get complicated. Use it regularly, early. Get all the free preventive care that you can get, because that's the only way you can really protect yourself and your family.
Beautiful. And Sinsi, where can people find more about Families USA?
You can go to familiesusa.org. That's our website. We have all sorts of different information on a variety of different healthcare policy topics that we cover, including some of the infographics that I know you showed. And we have really interesting blog series as well on a whole bunch of different aspects of healthcare.
Beautiful. And you can see the address on the screen as well. Donna?
So I'm going to talk about something real quick that may not have grassroots action at the moment, but that's going to be critically important, and that's paying attention to what happens at the Supreme Court in June, and the King versus Burwell case that could overturn or really upend the Affordable Care Act. And just want to really encourage folks to make sure and pay attention to what's going on with this, so that everyone, no matter if they have a state marketplace or they're using the federal marketplace, that we keep subsidies for everyone, and that we also really encourage the Medicaid expansion in the other states. Those are key issues that CAP will be working on, in the very near future.
And your website where people can find more information?
Thank you. We're at AmericanProgress.org. Thanks. Sorry for the sirens.
So AmericanProgress.org.
Yes.
Thank you for that. And you can also see that on the screen. Jose?
So I'll reiterate again. This campaign, this law is about education. I think in Coalition we've done a great job these last two open enrollment cycles of getting at those ones that we know are uninsured, and those that have access to technology, and that are bilingual, and watch the news and are able to go out there and get coverage. But what's important is that we all know someone that might not have health coverage. So if you hang out in your group of young millennials, of young professionals, of the DC policy wonky folks, step out of that circle and investigate who in your community might not have health coverage. Folks in hotels, people that are cleaning your offices, all these people are the ones that are in the most dire need of health insurance, and it's about providing insurance. You know how many times I jump in a cab or an Uber here in DC, and that's one of the first questions that I ask the driver, because these people are self-employed and are the ones that are sometimes the most disconnected. And those are the ones that are going to be the target this third open enrollment, because they are the ones that are most at need. And they've gone now 2 years without health coverage when this is now the law of the land. And so it's important that we continue this education effort, not only within our immediate circle and the moms and the girlfriends and lovers and whatnot, but making sure that we spread the word and get folks out there to be informed.
Beautiful. And where can they find you, Jose?
Well, I live in. I'm just kidding. No, you can find our organization at getcoveredamerica.org, and you can find ways to volunteer and really be part of the effort across the country.
Beautiful. And Tony?
Hey there. I think a lot of folks have touched on the important ways we can make a difference. What I'd invite everyone to do as well is to visit minorityhealth.gov. Click on the information about Minority Health Month. There's a Take Action page there. And it doesn't mean take action just during Minority Health Month. It means throughout the year. And to end on an incredibly shameless plug, on April 30th at 2 o'clock, we are going to have a Health Equity Thunderclap. And it's important that we say to those people who follow us online that we're going to make quite a bit of noise about health equity. It's an important issue, and so I invite everyone to join that thunderclap. Thanks.
Wonderful, wonderful. Well, you heard it. Let's make National Minority Health Month a year-round celebration, because the people who are affected by this are affected every single day of the year. So we need to get involved, become aware, and also make aware everyone who is around us. I want to give a big round of applause to my guests tonight. Thank you, Donna, Jose, Sinsi, and Tony, for all your insights. I learned a lot, from the history to like what we can do to become more aware and more engaged. So I appreciate everything that you shared with us tonight. And I want to urge folks to please follow all of these organizations. You have the addresses on the screen as we speak. And I see you all next week. Have a great night. Thank you.
Bye.
Thank you.
Good night.
Good night.
Bye.
Bye.